We have had a rich conference on interoperability. You've understood that this is something that we find especially important at the French e-health agency. We talked about the construction of the European health data space, the interest in standardizing the formats. I think that this is essential, using common health terminology, particularly at a European level. This is a major issue as this is a European event, and this will allow us to fully capitalize on the semantic web possibilities. With Nicolas, we looked at the modelization of health center and then going more into practical applications. I would like to come back beyond the regulatory issues and technical issues to take a bit of a hindsight, have a little look from above at a social aspect. The main people affected are healthcare professionals. They are the ones producing the data and using the data. This is essential for us to remember. All of the algorithms that we can implement and the enormous difficulty in diagnosis and research that goes well beyond the competencies of some researchers. This is possible, but there are still a lot of questions, particularly questions from citizens, and we will need to be answering them with very concrete responses. Europe has been working on its values, and we need to be leaders. When it comes to data production, particularly for mass data production, we need to have a systematic approach. This is what we have with the program in France at the moment and its funding. We've become a little bit behind schedule on this. We know that all healthcare professionals are affected, whether it's hospitals, imaging, biology, all of the different departments, pharmacies, medical, social centers are producing mass data that they need. This data is structured, but sometimes it's not even structured. And this takes a lot of time. We're at a starting point at the moment. In this context, I would like to go back over some things. Through Melissa and Taib's presentation on terminology services and repositories, the French multi-terminology server and drug interoperability, under the Ségur program for healthcare data interoperability has required the work of and the collaboration of the WHO. We need to have common and shared health models in order to have the success that we need for collaboration at a European level. In the French context, the French e-health agency works to implement interoperability, particularly with software publishers, so that software can be referenced and then deployed. As I said, this is through Ségur. This is a transformation platform we're still referencing. So for those of you who have not applied for this, you have until the 15th of May. This may even be pushed back until the 15th of June. So there is still time. In the second phase of this program, funded by Europe, we're going to be translating a new health terminology. This was mentioned in some of the work and Summit City. This is very interesting for research, but also for any cross-border exchange within the French e-health agency. In the long term, Summit City will be published on the terminology platform. There will be terminology alignments. and it will be available for publishers looking to implement it through the second phase of Ségur. The multi-terminology server will be available for all clinic databases and national databases. And we hope that as the issues are shared, we're hoping that there will be a European multi-terminology. That's what we hope, and that's what we're working towards. There are a number of different use applications for Ségur, for medical summary as well. We are going to be complying with the pivotal format chosen at the European level. With regard to data production, I talked a lot about transformation and mass data production. But I would like to discuss some other aspects. Data production also can be used for telehealth, remote health, and remote monitoring so that we can collect data through connected medical devices, whether or not they are embedded or not. We need to be able to handle this data and store it with correct security procedures in place. I'd like to come back to this because I think it's very important. We need to show the developments that we're making in security so that there is data interoperability. Yes, of course, but we can also see substantial evolution and change within the storage and hosting requirements for data. Our European colleagues and ourselves use certified hosts, and we're working to change these standards, drawing on work from the European cybersecurity certification procedure, which will be implemented. For patients, they are also ones who use the data. We're going towards a personal participatory medicine, which you also know. You are all experts here, you're well represented, and in order to increase confidence, we're going to need to work hard. There are key issues because public and private actors have a role to play in order to increase confidence in medical data that will be available to patients. This is a gamble, but it's also a real opportunity. We can see it with health in France. We're giving citizens the opportunity to take hold of their health data and familiarize themselves with this concept. And that's one of the aims of this conference, is to raise awareness of this. There's a real gamble in this area. We know that other digital actors also have large ambitions in this field. I would like to come back to cybersecurity issues, as this has been a major issue in 2020, 2021. There's a response team within our eHealth agency with regard to cyber threats. In early 2022, the situation has not improved, and we are trying to avoid major data leaks. This is not just happening to other people. We had some issues at the end of last year and the start of this year. We need to avoid the mass leak of data. This needs to be eradicated or at least limited. This is a common responsibility, a shared responsibility for us all. And finally, I would like to say that the creation of a European level health data space is a great opportunity for research in order to provide better care to European citizens, and it will have a positive impact on health. I'd like to say that there's an event being organized in a few months since last July, we have worked alongside European colleagues to organize an event on this topic, and you are very welcome to join us for that tomorrow. Thank you.